Have there been challenges with outreach given that traditionally you have older patients who are used to going to the pharmacy or their doctor's office to get a vaccine? And in this case, they're required to, log into a website.
Absolutely. That has been a very large challenge for our population. We do have a way that they can dial in and actually set up the appointment one on one with somebody over the phone, and they can enter in their information online. That process has been very successful. As long as somebody does have a phone or access to email, they can register for the vaccine.
You're also a professor. How are you advising your students or pharmacists in general about best practices when it comes to having those conversations with people about who's eligible and whether or not they can get one at that local drugstore?
Absolutely. So we have got some pushback where patients may or may not be really interested upfront for the vaccine, but we have been counseling them that the benefits do outweigh the risk. It is something that it is absolutely recommended by the CDC that somebody does obtain that vaccine, even if they do have multiple medical conditions. It's still better to be vaccinated and be protected from COVID-19 than to get COVID-19.
One of the challenges has been reaching parts of rural Arizona. As I understand it, there are mobile clinics that are in the process of rolling out. How effective have they been thus far?
Yes, absolutely. So our mobile clinics will be rolling out this week, and we are going to be covering all of Maricopa County. So we are super excited about that. It's also a way that we can improve access for patients. So when we are on site, we can actually enroll them with the website at that time. So since we're able to enroll them one on one, that does decrease some of those barriers as well.
Can you give us some idea of how exactly they'll work? I mean, is it literally a bus that has qualified staff inside where you could go in and receive it?
It really is. It's a bus that's set up with medical equipment inside. We do have a refrigerator to store the Moderna vaccine. That's the vaccine we were approved for here on the College of Pharmacy campus. And we have trained personnel inside. We also have a supervisor, a pharmacist, or a physician to oversee the patient after they've received the vaccine. We do monitor them for 15 minutes if they don't have a history of allergic reactions, just to be sure. We have EpiPens on hand. If they have had allergic reactions in the past, we make sure that we monitor them for 30 minutes.
Dr. Henry, one of the concerns has been that though vaccines are free, when you go to get one, you're asked about insurance. Why is that? And how are you managing the messaging in that case? Because it could be discouraging if someone doesn't have insurance.
Absolutely. We do encourage patients that it is free for all. We do need to try to build their insurance and make an attempt at that at first before we can build our HRSA program through the government.
In general, it seems there have been conversations about how people are skeptical of the government wanting to inoculate people. You're a pharmacist. How do you have those conversations?
Yes, absolutely. We've heard all sorts of things. This is a government chip. It's going inside my body. I don't believe in it. You name it, we've heard it. Basically, we have the one on one conversation with the patient. We do involve the family member as well, if that's an option, and just have a discussion that the benefits outweigh the risk. There's not a government chip inside this. We are administering a vaccine that is life saving in these populations. It's absolutely recommended. And by encouraging them that way and listening to their concerns, we listen to them, we go over each concern. Really, we've been able to motivate them to get their vaccine.
How do you teach future pharmacists based on what you've learned through the COVID-19 pandemic? Are there things that you wish you would have been doing sooner and things you can implement moving forward?
I would say that it's best to make sure that the patient is heard and they can come up with their own decision about getting the vaccine. So, this is not something that's mandatory, it's a shared patient decision making process. So, I think that it's really helpful to teach students to treat patients like equals, to treat patients like it's you or I getting a vaccine. If we're scared, we're not going to want to get it. Right? I mean, we need to have somebody that's willing to listen to those concerns, break down those barriers, and really encourage them that we're healthcare providers. We're all in this together, and they do need to get the vaccine to help bring hope back to humanity and have everyone be protected from COVID-19.
Okay. Dr. Nicole Henry from the U of A College of Pharmacy, thank you.
Thank you so much.